Hi, my name is Megan Freeman, and I'm a student in EDM 310 at the University of South Alabama.
And I'm Renee Sprague, and I'm a clinical professor at the University of South Alabama College of Nursing.
Okay, so what exactly do you do?
This semester, I've taught a pediatric clinical rotation with 8 students. And next semester, I may teach an OB rotation and pediatric clinical rotation at the same time.
Well, in the class that I'm in, we do a lot of project-based learning, and I think this is the first time I've ever done it or noticed that I was doing it. So how do y'all incorporate that?
We teach a theory class at the school that the students go to once a week for the entire day for 8 hours. And then they have 2 clinical days during that week. So they take what they learn in the classroom and they see it firsthand in the clinical setting. That can range anything from disease processes to medications, assessments of their patients. And we try to get them to incorporate theory, research, problem-based learning, and clinical all into one. And they do that through the paperwork they turn into us and actually interacting with the patients.
So they learn everything in the class and then get to go practice, like in clinicals?
Yes, technically practice, like not really practice, but they go and based on their paperwork, they have to do care plans and they have to meet their patient the day before and they fill out all this paperwork we give them based on their meds, the assessment they see of the patient, reading their chart. Mm-hmm. Then they go home and look at research articles based on the disease process, how to care for that patient. They
so
look
it's like a fake patient?
No, it's a real patient. They go look at. We just don't let them they don't start IVs in pediatrics because they're kids. In adults you can do that, but I don't let them do it in pediatrics. But they compile research articles, pathophysiologies. They know their medications. They know the side effects of their medications that are related to their patient, and they put all that information together and come up with a care plan. So they have 3 nursing diagnoses that they come up with that pertains to their patient, and they practice those diagnoses the next day. Like if it's a burn patient, then one of their diagnoses would be acute pain. Mm-hmm. So then they come up with nursing interventions and actions to treat that patient. Like you would give them morphine, you would assess their pain scale, you would check their vital signs, you would help with diversion tactics so they're not in pain, which would be your project-based learning. Yeah. It's putting all of this theory information they've gotten and research information into practical use.
Right.
So it's not just regurgitating information to me.
Okay.
Yes?
Yes. So, they get to actually see patients.
They do see patients. They each get one patient, and they do total care, which means they're checking their intake and output, they're changing diapers, they're bathing, they're changing the bed. When they go to give a medication, I quiz them on what the medication is, what does it do, why is their patient getting it and not, I don't want the generic use of it. I want to know specifically why is their patient getting it, what side effects should their patient be aware of, what should they be looking for, and then how would their assessment of that patient change based on the medication they're giving. So if you have your burn patient, they have a lot of pain, you're giving them morphine. Yeah. A side effect of morphine is respiratory depression. So they need to know that that's what they're looking for in their baby. In an adult, a side effect of morphine is itching. I'm not so concerned about a baby itching. I'm more concerned about them stopping breathing.
Yeah.
So if they're just memorizing their medication cards, then they're going to tell me itching is a side effect because that's the number 1 side effect. But if they read and understand what the side effect is pertaining to their patient, they're going to tell me respiratory depression. And that's how I know if they're just memorizing information or if they're actually understanding and kind of compiling information in their head regarding their patient.
Yeah, because you have to put it all together.
Right. And a lot of them, some will memorize, and I can tell the ones that cut and paste and put it into their paperwork because they're not prepared for clinical number 1. And they have no critical thinking skills. That's huge in the medical setting, is being able to have one train of thought and think this is what I need to do for my patient, because your patient's going to change at a moment's notice, and you've kind of got to have a whole nother track of thinking as to what if they're a burn patient that gets infected and then gets pneumonia on top of it, then you've got to put all 3 of those things together and be able to treat the patient because it's one patient. If you only memorize the pathophysiology of burns, you're not going to know how that affects breathing and infection control and that kind of thing, and the medications that you would use for that. So I constantly tell mine they've got to critically think. And by the end of my rotation, hopefully they figured out what that means, because I sit down with them individually and go over their care plans and show them where they messed up and possibly what they need to fix. And I always say critically think. Like, don't just give me don't just tell me what you've read in a book. Like, I want you to put it together for that patient. And it's obvious the ones that get there and the ones that just memorize.
Right. Okay, so it's good to know that we have other teachers that use project-based learning. And this was Megan Freeman and Renee Sprague. Thanks. Bye.